practice is a new practice. We were fortunate that we were able to become electronic from day one. So it was just a matter of finding the type of electronic medical records and practice management software that would not only complement each other, but also complement the practice of dermatology. Prior to opening my office, I did have experience with a couple of different electronic medical record programs, the last of which was EMA. So I had seen a lot of good and bad, but ultimately came to the conclusion that EMA was the right one for our practice. What interested me in EMA specifically was not only its ease of use, but its tablet-based software and just how it flows specific to dermatology. The images are excellent. Even they're always updating it now. They have better even clinical images for the patients. Everything about it seems to really be great for not only medicine, but specifically dermatology and all of our specific diagnoses and procedures and even consents. Like, everything is there. With EMA and the iPad, it takes excellent photos. Not only the headshot of the patient, which is actually really important because it really helps quickly identify the patients that might have only come in one time 6 months ago, but you can easily then pick up on them and remember not only the visit, but what we dealt with and how we treated them. Also, for some of the cosmetic patients that we see, we've had a couple instances where people would call and have issues with their work or whatever we had done, and when we go back and show them the photos, it's like, oh wow, you're right, actually I had that defect or that asymmetry before we started, or you're right, there was a correction, I just didn't appreciate it now. So those are kind of things that are extremely helpful when not only evaluating a patient, but also being able to just follow them and be able to compare and contrast things. Regarding that same line, the images are especially important for skin cancer and biopsies and moles and just tracking of patients, because a lot of times, specifically in Florida where I live, people have a lot of sun-damaged skin. So sometimes if they don't follow up right away, you might even be able to find that previous biopsy site, and there's a lot of damage, and without a good photograph and good mapping technology, it would be extremely difficult to take care of that patient. When we refer patients out as well, oftentimes it's very helpful for the other doctor to be able to see our notes and to be able to appreciate exactly where those problems were and how we treated them. One additional thing that I've been liking and using a lot recently is being able to fax notes to other providers, and now even the e-prescribing as well. It's very quick and easy. Once you save that patient's pharmacy info, once you save that the referring doctor's information, it's basically a click, and it creates a really nice note and it submits it instantaneously. So all those things have been really, really helpful, I think, in are facilitating a great business model. My future vision for my practice and EMA is one of continued growth. I feel that it's a software that helps us not only take good care of patients, but also translates into good quality of care for both the patients, but also for us, because it's important that we're able to have good notes for whether it be a referral when we're sending a note to another specialist or to another doctor, or for communication that we have to do. The notes are really bulletproof, and that also goes with insurance claims. As a new practice, it seems like 30% of our claims get questions, whether it be they require additional documentation or wherever that may be, and we're able to submit a perfect note with pictures and images and everything that's necessary to have that claim appealed. Regarding Modernizing Medicine, as a team and a partner, they have been really great. Anytime we have a question or a concern, someone always answers the phone, and they've been always really helpful, just like troubleshooting or just helping us, figure out what we've been doing wrong or what we're missing. Basically, whatever we need, they're accessible and very helpful.